Hello, my name's Clara Rehan. I'm a clinical psychologist and I work with people with physical health problems. The aim of today's talk is to help the IBD nurse understand the nature of adapting to a chronic disease and how that relates to people with inflammatory bowel disease in particular. We're going to look at the physical, psychological and social implications of having IBD and those challenges that an IBD patient faces. We're going to look at how the IBD nurse can assess patients' coping and how an IBD nurse can actually help the patient also. And then consider who the patients may be that may require more in-depth help from specialised services. So first of all, I want to talk about what adjustment is. It's really important to realise that adjustment isn't a single event. It's a number of different coping mechanisms that a patient might employ to overcome and manage a disease. It's important to know what adjustment looks like in a patient. Adjustment itself is the person's ability to minimise the disruption in their lives and regulate the emotional response to having a chronic condition. Therefore, they're able to maintain the number of active aspects of their life that hold meaning and importance to them. When considering stages of adjustment, I think it's important for the IBD nurse to know that there are no definitive stages of adjustment. We're all aware of stages such as the Kubler-Ross stage of adjustment for grief, and understanding these processes is really important, but to have a set of stages makes it difficult to look for individual differences. It's very important to consider a patient that you might know yourself. You may know two patients with similar health problem, with similar severity of condition, but their response to their physical and psychosocial functioning is very different for each patient. And this is why these stage processes sometimes cannot be a helpful way to look at adjustment. It is important though to recognise that very often when people are diagnosed with IBD, initially there might be a sense of relief. Often they've been struggling with a physical health problem that they've wondered what the cause is, and to be told that they have a chronic condition that isn't life-threatening can be very positive for some patients. This feeling of elation or happiness about finding a cause and possible treatment may not remain, and people may feel grief, a loss of appetite, loss of sleep and a lot of other symptoms that can be identified, but these will settle over time. It's when these symptoms actually progress, when people are a couple of years down the line and still not managing these feelings of feeling irritable, anxiety, that may be when people are experiencing a problem with adjustment. The main focus of this talk is to consider what the challenges are for the IBD patient and looking at how individual challenges may affect people differently. An example of this is the sense of urgency that a lot of patients when they're in flare-up experience. If we consider urgency and think about 3 different patient responses to that feeling, it may be helpful to consider the patient that just fills the backpack up when they're having these sensations and carries on with their normal day's life, just filling a backpack up with spare clothes to help them through the day. Another person, though, may change their behaviour. They may go to just places that they're familiar with, where they know where the local toilet is, and not go on or attempt new journeys where they would not know where the toilet is. A third person, though, in contrast to these other two, when they're experiencing a flare-up or these increased sensations of urgency, may stay at home, lock themselves in, avoid social contact. This example sort of demonstrates the importance of finding out how much a problem might impact on a person's life to help you decide whether a person's struggling or not. Just to note that anxiety and depression tend to be symptoms that occur in patients when they're struggling to adjust to their health problem rather than an outcome of having IBD. This slide demonstrates some of the types of challenges faced by the IBD patient. I'm sure you're all familiar with this. Each patient, depending on the time frame of their disease or the types of problems they're having with the disease at the time, may have to adapt and adjust to this. I think it's helpful to think of adjustment as being a potential endpoint, but sometimes patients may have to deal with new drugs, new side effects, and regular flare-ups, and these might change and people have to adapt to this. The nursing perspective is that we want a patient to be able to self-manage, that they're able to manage inactive disease phases as well as flare-ups. And as we identified before, adjustments indicated by that person's ability to minimise the impact of IBD on their life and regulate their emotions and actually carry on with meaningful activities. To be able to facilitate this, it's important that the IBD nurse assesses where the patient's at. That's looking at what the beliefs are about what the illness is, and also about understanding their understanding of the treatment. And therefore, it's important that the person feels confidence in their IBD nurse and is able to confide and discuss problems with the IBD nurse. Therefore, my key is it's important to know where the patient's coming from. These collaborative relationships are extremely important. It's well recognised that psychological distress is often underreported in many populations of people with physical health problems. Often we tend to focus on the physical health of a patient rather than the psychological health. The key to good psychological health is that it will actually enable a person to become more able to self-manage their disease. So, how do you assess a patient that they are coping, that they are adapting to their illness, that they are managing it? Again, looking at where the person's coming from, the key is communication. The evidence is that if you actually provide the right psychological support, the basic communication skills that you've learned throughout your training, this will enable a patient to feel more confident in their ability to cope, but also that it prevents against psychological morbidity. One of the important things to remember is that as professionals, we often want to help patients and solve their problems by giving information, by giving a reassurance. It's important, therefore, that you don't jump into, if you identify a problem as lack of knowledge, that you jump in by giving that knowledge. That tends to block good communication. So before jumping to the actual treatment options, it's important to hear what the patient's point of view is and understand where they're coming from. I often get to see people that are referred to me, and I'm told by professionals that they've been told many times about their disease and they just don't seem to understand. And I think sometimes it's very important to recognise where the patient's at and whether they're ready to hear what you have to say. And therefore, finding out what the problems are and how the patients are coping helps guide your response to them. This is an acronym I've just made up, and it just helps you perhaps be guided by what you need to do when you're actually with a patient. Obviously, setting the agenda, making it a place where you can actually sit with a patient, providing good eye contact, knowing that you won't be interrupted and that you are able to listen. What's really important though is to ask the questions. Ask people, how are you coping with your IBD? Is there anything about your IBD that is concerning you at the moment? Is there anything that stops you being able to cope with your disease at the moment? What would be a good outcome of having a conversation with me today? These are very open questions that allow people to tell you what they need from you and guide your communication. By asking these questions, it helps people have permission to say what they're struggling with. S is for stick to what the patient's saying. Obviously, as an IBD nurse, you'll have other things to be able to ask about, which include symptoms, but by sticking to that person's agenda, if they say that they're having problems with more urgency, rather than jumping to the IBD cause and thinking about other strategies, checking out, is there anything else going on with somebody's life? We know that there is a clear link between stress and frequency in bowel movement, and just as an IBS patient may experience this, or when you're having exam nerves and you experience the need to go to the toilet, in the same way a patient with IBD may also experience these. So looking around for other reasons for a person's problem is also helpful. Empathise. It's important to go and listen to the patient, show that you've heard and understand where they're coming from. Often patients don't need an action from you, it's just knowing that they've actually been heard. Often problem solving is a helpful resource that you have in your toolkit to help understand where a patient's coming from, but also to help them generate problems and solutions to problems. With problem solving, this allows a patient to come up with their own solutions, and by doing this they're more able to feel empowered and also able to be able to self-manage their condition. At the end of a session, perhaps summarise with a patient what the actions that they've decided that might be helpful to help them adjust to their problem. And then offer a follow-up. And remember, at follow-up, check up, how did it get on? Did it work? By asking a patient what they believe would be the best solution to their problem helps you be guided by what that patient wants. Another example would be a patient ringing too frequently at an IBD helpline. And often there's a number of reasons again for this, and often just by identifying the reasons may help you clarify even further what the person wants to know. It might be a lack of understanding about their condition and a belief that they're having a flare-up, or it might be about feeling anxious about what's going on. It's really important perhaps to ask the patient the question of what would be a useful outcome of this telephone conversation, to get a sense of what's going on for that patient and what the patient really wants from you. For anxiety, it might be just a bit of reassurance they come up with. I just want to be told that it'll be all right and soon it'll be better. And just checking out what people want to hear would be helpful. And this is a list of possible reasons why people report depression when they have IBD. As you can see, there's a lot of possible reasons. By identifying the reason from a patient will help you gauge what you can do as a professional. Understandably, somebody who's been unable to attend work or has lost their role at work, as a health professional, it's very difficult to do anything about it, but actually acknowledging that must be really difficult for them. That might be all that is required as a health professional. In addition, people who have previous mental health problems may be more at risk of experiencing depression when they're actually ill again. At this time, they might be the best person to ask, when do you think you might need help for this problem? Being physically ill is understandably a reason for causing low mood, and it's important that that is acknowledged and normalised, but also allowing a patient to make a decision when they feel that they might need help. So in summary, these examples allow you to identify problems that a patient may have. It's important not to jump to conclusions of what a treatment option might be just based on the cause. Often the patient themselves can come up with the best possible solution, and it's often your job as an IBD nurse is to facilitate that, to allow them to come up with what might be the best action for them. When does the patient need specialist help? Often when people see me, it's because they're unable to function with the activities of daily living, and that's probably due to feeling pretty low in mood or feeling constant set levels of anxiety. Or it might be that their anxiety is such that it impacts on their everyday life and they're unable to work, and this is at a higher risk than their IBD. These are the sorts of things that you might be looking at or hearing from a patient. It's important that you ask whether the patient wants help and see if people feel that they feel that their health problem is improving, or that they feel that they have strategies to manage their anxiety and depression. Often patients are happy to work with their own health problem just to be guided by yourselves. So in conclusion, hopefully at the end of this talk, you've been able to identify that people are individuals and there are individual differences in responding. Poor adjustment can lead to psychological problems, and this can cause self-management difficulties with IBD and reduce quality of life. It's therefore important that good communication skills can support a person so that they don't necessarily develop any mental health problems that could impede self-management. It's important that you're able to assess mood and coping so that the patient can state when they are having problems. As earlier on in the disease, they may feel they're coping quite well, but the fact that you've asked early on means that they're able to state a problem later on in the disease. Assessing the mood and coping therefore gives a patient permission to say how they're feeling. These references may help you in your assessment of patients.